Now, we are told that even with our medical stores, we do not have such vaccines in place. What are we supposed to do as a country?
Thank you very much. And let me salute those who fought for the independence of Ghana. Today is Ghana Independence Day. Kwame Nkrumah and all those who fought for the independence. But very sad today, you are asking me this question about shortage of vaccines. It makes me to have a mixed emotions of happiness for Ghana independence and sadness for the future generation who are coming up to pay the debts we are creating today, who don't have vaccine to save their lives, to be able to secure the name of Ghana at the highest level. It is very dangerous for a country not to have vaccines for its children, especially the 3 vaccines that you have mentioned. Polio, we know the long-term effect would be debility, disability, where the person cannot be able to move and be physically fit for many activities. Measles can lead you, destroy your brain, and make you think you don't function, your brain doesn't function well. It can even lead you to death as well as polio. Whooping cough, we know, can destroy your lungs and lead the children to death. If these 3 highly infectious, not that they are highly infectious, if the vaccine is not there, they will be compared to corona. They are highly infectious, and they are much more debilitating in children. It means that they make the children very sick, and probably some of them will lose their lives. Some of them would have disability forever. How come as a country that touts itself as a country moving without aid, be crying for lack of vaccines, when we know very well that this is an elaborate international program which the government doesn't need to think on how to implement it and how to structure it. It has been structured by international organizations and being used by every country. The only thing the government needs to do is to provide the funds. However, much of these funds are provided by donor communities. Much of these funds, not in cedis, but in dollars. How come that they are telling us that exchange rate has caused them their inability to procure these vaccines to save our children? Really, it's a sad day to talk on vaccines shortage in Ghana on the Kwame Nkrumah Independence Day of Ghana. They think that our children are highly exposed. Even adults, I tell you, adults are suffering measles in Ghana today. I have got 2 patients admitted in my hospital about 40 years who have suffered serious consequences of measles in my hospital. What about the children? So I think there shouldn't have been a need to discuss this thing in Ghana at all. Because, look, most doctors who have grown and who are currently working have not seen polio, have not seen measles, have not seen whooping cough for a very long time. And this may come disguised, them making wrong diagnosis because they have to reactivate the knowledge about these diseases to treat. So I think the government has done a very serious harm by not procuring these vaccines in time. And also note that the Ukraine war or coronavirus, as their excuse, have prevented the manufacturing of these vaccines. These vaccines are still manufactured. The only thing they need to do is to transfer money and collect them and come and vaccinate our children. So it's very sad. That is why some of us are calling that we don't see how we can be celebrating Independence Day with children who have been vaccinated to march on our streets, while those who have not been vaccinated are helpless for these viruses and bacteria that can attack them and extinct them. I think that we should emulate very good countries like Tanzania, who just recently, 7th of December last year, canceled Independence Day celebration, saved $364,000 and built 8 international model schools for rural communities. How much are we spending for this Independence Day celebration? That if our president tells us that, look, because of shortage of vaccine, we cannot use this money to give to people to come and run on the street, the children to come and dehydrate on the street, and we have to look for ambulances to even carry some to hospitals. Kwame Nkrumah will be very happy if we suspend this Independence Day celebration and buy vaccines for children. I don't think he'll be angry with us. I don't think any chief in this country will be angry with the president. I don't think any opinion leader will be angry. But it is simply because priority is not in their lexicon. That is the problem. We need to prioritize this country. Our funds are scarce. You are going for IMF loan. You have children without vaccines, but you have money to celebrate Independence Day activities. You have money to go and watch matches with a pool of cars, wasting fuel to go and watch a presidential cup match. I think we should have to set our priorities well. And my heart pains for the little children, their families, who are going to bear the consequences of the lack of this vaccine. Promises have been made, but they made these promises and they've not fulfilled it. I remember in September we called that there was shortage of vaccine in the north, in some parts of Kumasi. The director of public health in Ghana Health Service told us that in 2 weeks it will come. Where is the 2 weeks? Where is the 2 weeks? It has passed. It's getting to months.
And no one
now
is
no
one is accounting for that. No one is accounting for that, I guess.
No, somebody must be held responsible. Remember the Sputnik V. We didn't see the Sputnik V and went and paid money. But this vaccine is lying down in a factory, in warehouses, but they are not buying it. How could we pay for Sputnik V? Let's ask the minister. How could you pay for Sputnik V, which was not available, but you cannot pay for measles vaccine, polio vaccine, tuberculosis vaccine when they are lying in warehouses? Where is his priority? And not that you don't have the money. No one can tell me they don't have the money because coronavirus gave Ghana an excess of 10 billion Ghana cedis. National Health Insurance says they are giving government over 60-something million Ghana cedis to buy vaccines. What is all that money doing? And you are exposing our children to these deadly, highly infectious diseases, not even children, adults. Because you know there is a lot of surge in tuberculosis now, and adults are suffering. What about if a child gets it? Because we play with our children, we go to adorants. Somebody will deliver, we'll all go and greet. Somebody may have it incubating in the body, it's not manifesting it, and this is spread by air. You speak, it comes out, and the child contracts it, and destroys his gut, destroys his bones, destroy his brain. We don't have people, a good water drinking source of water. People eat anywhere, drink anywhere. Polio is spread by that means. You want to infect children with polio. In 15 years' time, we'll have so many disabled people in this country. And that is the time that we have to pay our loans, the loans that they are enjoying today. That is why some of us are calling that this date celebration should have been cancelled and the money used judiciously. Quite apart from that, the Minister for Health is not doing us any good. He's a disaster, but he still maintains his post. How then are other people going to get scared that they should act well?
Interesting.
He punished us in COVID-19, and he's doing the same thing now. It's not an emergency. It's a program vaccination. Program vaccination that means that you have a year to plan ahead. Why didn't he plan ahead? Didn't he know that the exchange rate would increase when they were mismanaging the country and the CD was depreciating? Didn't they know that the exchange rate would go up? Don't they have forecasters to know how the exchange rate would go? Couldn't they pay in advance for them to keep the medicine the day we want, we go and pick them so that the exchange rate would not affect it? Please, I think there is a serious mismanagement in the country, and worst of it is now on health. We shouldn't subject our children to this type of barbarism, because to me, it's just like subjecting them, oh, you suffer, die. We don't care.
Doc, my very last question, but equally the very most important of it all. Now, the question is that what ought to be done if a parent is listening to us this morning and has a baby between 0 to 3 months without this vaccination, and in the absence of that, as a medical doctor, what advice can you give parents who are watching and listening to us this morning as to how to control their babies?
As for the parents, we can't say anything that will make them so scared the more. We advise them that anybody who has a child should limit him from going into crowds. Visiting neonates we should limit it to their mothers. Improve breastfeeding. And then waters we give to our children to drink should be properly boiled to make sure that if there's polio virus in it, it will die before they give it to our children who have started drinking water.
Okay.
If there's a funeral, if there's any gathering and you think your child has not been vaccinated, stay away from those gatherings. Don't be handing your children to people you don't know very well, or limit handing your child to children so that they don't contract these very highly contagious diseases, so that when the vaccine comes, you can now inoculate your child and have the free mind that at least if even he gets the infection, it will be in the milder form, not in the severe form. That is what I advise parents. And also advise them to raise their voices and call on government, their GCEs, to tell their government, their president and the minister to make sure the vaccine comes at the right time, to come as quick, as early as possible to avert any serious consequences in the future. That is what I'll tell them.
Dr. Chomasadaba, I'm grateful this morning for your time. Kessben is grateful.
Thank you, and a pleasure.
Okay.